Do you look like this? That's what I looked like when I was taking high-dose prednisone. It's no fun. Not at all. Look at all those side effects. I'll get a little closer so you can see more in depth. So many side effects. So that's what I'm going to talk about today. I'm Dr. Megan, your prednisone pharmacist, and I'm going to give you the ultimate list of prednisone side effects. First, I'll cover these ones that I personally experienced, and then I will share with you the ultimate list that doesn't exist anywhere else. There is no more comprehensive list than what I'm about to share with you today. So, I personally experienced emotional roller coasters, including roid rage and insomnia. Oh, I could not sleep. Hot flashes like a menopausal woman, sweating and red cheeks. Just, oof. My face was so round. You see these cheeks? They were round and they went down like this. Oh, completely like a moon. I would get these weird heart palpitations, like beating really fast or beating in like these weird rhythms. My muscles got smaller. My arms and legs were skinnier than they had been in years, but it wasn't because I'd lost fat. It's because I'd lost muscle. At the same time, I had this insatiable appetite. I was so hungry and I wanted sugar and I wanted salt and I wanted it now and I wanted the entire cake, which led to weight gain. And prednisone does this miraculous thing. It takes the fat and everything and puts it in places you wanted it, like your belly and your moon face, and sometimes even your shoulders, like your neck area. Next, and food cravings. I forgot to mention that. I retained water. It was so weird. I felt like I could pee more than anybody in the whole world. One day a week, it was just like, psh. All right. Then I would get these bruises that didn't hurt. Just anywhere. They weren't real bruises. They were called ecchymoses. Then I get swollen knees, just like my knees would hurt because there was so much water on them. It was such a weird feeling. And then I couldn't feel this, but I knew it was happening. I was getting a bone loss, like osteoporosis in my 30s. That's not supposed to happen. I would have impaired wound healing. It was harder for a cut to close. It was harder to, they would prick me every week to get blood, to test my blood to make sure that I was still not bleeding to death. And it would take a long time for all of those pricks to heal. Like I looked like a druggie. I looked like I was injecting and I wasn't. And I had high blood sugar and high neutrophils, which makes it look like you're sick, but you're not. Finally, I had a hand tremor. Just out of nowhere, my hand would just, all right. So that was me. Now what about all of the possibilities? So now why do I say that this is the most comprehensive list? Why do I say that there is no better list than this one I'm about to share with you? Because the lists out there are completely inadequate. The thing is, prednisone was invented in the 1950s. It never had to go the testing that other drugs have to undergo now, where they have to give it to 5,000 people and they can find out the percent of people who had each side effect. They can say, 10% of people had insomnia and 50% of people gained weight. There's nothing like that ever happened to prednisone. So what we know is not because a drug company had to do the testing. It's because somebody was really nice to collect the information over the years. So what's in the drug package insert that all of the information is based off has like no basis on statistics, on common, like what people actually most commonly experience. It's just a random list that someone created at some point, and it's not that effective at helping you know what to expect and how you need to cope. So that's where it came from. Number 2 is there's no great list that has all of the side effects. Like, for example, most drug side effect lists online do not say insomnia. Even though it's like the number 1 tweeted side effect, it doesn't show up on most lists. How does that make any sense? So I went to 5 of the best online drug references, Lexicon, Micromedics, Up to Date, Clinical Pharmacology, and the package insert on Daily Med. All 5 of those. And I compiled them all. And I created this list. And what I have is the category, the type of side effect, then the medical name, and finally the common name, what you might more likely understand. So we're going to start at the top, and I'm going to read you over 150 possible side effects to prednisone. You ready for this? All right, we will start with the category of electrolyte and fluid imbalances. The first one is hypernatremia, which is sodium retention, which means you're retaining salt. Fluid retention, or increased plasma volume. Leg edema, which is you're retaining water and you feel swollen. Hypokalemia, potassium excretion at the distal renal tubule, which is electrolyte loss. Hypokalemic metabolic alkalosis, which is an electrolyte imbalance. Hydrogen excretion at the distal renal tubule, another electrolyte loss. Anemia, a low blood count. Folic acid loss and glossitis, which is a low B vitamin. Decreased serum concentration of vitamin C, which is low vitamin C. Decreased serum concentration of vitamin A, low vitamin A. Pyridoxine increased dietary requirement, which leads to low vitamin B6. Phosphorus increased dietary requirement, which is low phosphorus. So you hear all those things that prednisone is messing up? Yeah. All right, now moving on to respiratory. Shortness of breath. Trouble breathing. Cardiovascular. So we're talking your heart now. Hypertension, which is high blood pressure. Congestive heart failure or cardiac failure, which is heart failure or heart like death. Hypercholesterolemia, atherosclerosis, arteriosclerosis, premature atherosclerotic disease. All fancy ways of saying high cholesterol. All right, fat or lipid embolism, vasculitis, necrotizing angiitis. Those are all really ugly heart complications. Palpitations, arrhythmia, sinus tachycardia, bradycardia. Those are all heart rhythm changes. Atrial fibrillation and atrial flutter, which sometimes is called AFib, and the heart is beating too fast. Syncope, which is fainting. Cardiovascular events. Now this is a miserable list. Left ventricular rupture, angina, angioplasty, coronary revascularization, stroke, transient ischemic attack, cardiomegaly, arrhythmia exacerbation, ECG changes, hypertrophic myopathy, pulmonary edema, cardiovascular death, all-cause mortality. That means dying. Heart problems. Those are all heart problems. Okay, more. Thrombosis or venous thromboembolism or thrombophlebitis, which is a blood clot. And the reason there are so many that are all kind of the same is each source that I used all called similar things different name. And so I tried to lump those together to simplify it for you. All right, myocardial infarction and cardiac arrest. Prednisone can give you a heart attack. That was page 1. All right, the last cardiovascular is epistaxis, which is the fancy word for nosebleed. Neurological, we're talking your brain and the nerves in your body. What are those? Emotional lability, that means mood swings. Happy, sad, angry, I'm euphoric. mood swings. Irritability, super cranky, I was. Malaise, which is a feeling of unease. A psychiatric disturbance, which is emotional changes. Insomnia and sleep disturbances. We have a hard time sleeping while on prednisone. Euphoria, feeling unnaturally well, lots of energy. Personality changes. Severe depression, like really bad depression. Anxiety and worried, that's what that is. Psychotic disorder, psychosis, schizophrenic reactions, mania, hypomania, hallucinations, delirium. All fancy words for saying you feel crazy. Withdrawn behavior, suicide, akathisia, which is restlessness. Increased intracranial pressure with papilledema, pseudotumor cerebri. I have no way to translate that for you. There is no common word for that. Seizures and EEG changes, which are like convulsions. Vertigo or dizziness. Headache. There's just a headache. Amnesia, dementia, memory impairment. That's being forgetful. Confusion and disorientation. We can feel confused and lost while on prednisone. Motor activity increase, just like feeling like you gotta move. Impaired cognition, brain fog, confused. Paralytic syndrome. Got no words for that. Ischemic peripheral neuropathy, which is like tingling nerve pain in your fingers and your toes. Neuritis and paresthesias. These are all just really hard to describe neurological issues. Steroid myopathy and myasthenia, which is basically muscle weakness. Muscle wasting. Oh, we moved on to musculoskeletal, by the way. That's the next category. Muscle wasting and amyotrophy, which is a loss of muscle mass. Myalgia, which is muscle pain. Quadriparesis, weakness in all 4 limbs. Arthralgia, which is joint pain. Osteopenia, bone mineral density accelerated reduction. Fancy word for your bones are thinning. Osteoporosis or bone matrix atrophy, which means your bone is not just thinning, you have lost bone and there's like holes in it that can lead to fractures, which leads me to vertebral compression fractures. The bones in your spine like squish together. Ooh. Tendon ruptures. Your Achilles tendon can break. Aseptic or avascular necrosis, which is also known as osteonecrosis of the femoral and humeral heads, which is essentially bone death at the top of your hip bone. Like the ball from your long leg bone, it just dies inside your hip joint. Ugh. Pathologic fracture of long bones. So you break your long bones. No good. Now we're moving on to gastrointestinal. Peptic ulcer with possible perforation and hemorrhage. GI bleed, perforated sigmoid diverticular abscess, which is holes in your bowels or ulcers. Just what we wanted. All right, that was page 2. Moving on to page 3. We're back on gastrointestinal, and we're going to talk about pancreatitis, which is where your pancreas is inflamed. That can be incredibly painful. Abdominal pain or distension, just feeling bloated and swollen in your belly. Hiccups, we all know what those are. Ulcerative esophagitis, like a hole in your esophagus, the thing that connects your mouth to your stomach. Ugh. Diarrhea and constipation, changes in your bowel movements can happen. Gastritis, gastrointestinal perforation, visceral perforation, irritation. Holes in your bowels. Some more different ways of describing that. And if you stop taking prednisone suddenly, abrupt cessation leads to nausea, vomiting, anorexia, and weight loss. So if you stop taking prednisone suddenly, you will feel sick to your stomach. Hepatic, that means our liver. elevated hepatic enzymes, increases in alanine transaminase, aspartate transaminase, and alkaline phosphatase. That is a fancy way of saying the liver enzymes go up. Steatohepatitis, cirrhosis, are fatty liver. Hepatomegaly, the liver gets bigger, it expands. Dermatologic, impaired wound healing. The wounds just don't heal as well. Skin atrophy, parchment-like skin, and skin thinning, which is thin, fragile skin. Petechiae and ecchymoses, which are red dots and bruises. Facial erythema, I had that, which is red face. Diaphoresis, that's a fancy word for increased sweating. Acne vulgaris, acneiform rash. Nothing like having acne when you're feeling sick. And zits is the simpler word. Hirsutism is male pattern hair growth, getting a beard, facial hair, chest hair, hair loss here. That can happen. Telangiectasia, which are spider veins. Striae, which are stretch marks. Alopecia, which is balding. Xerosis is really dry skin. Purpura is a purple colored spot on your skin. Lupus-like symptoms. You feel like you have lupus, which is an autoimmune condition. Perineal pain and irritation, which is pain around your genitals. A rash. There's just no better way to describe that. A rash. You can get a rash. And finally, for dermatologic, suppressed reactions to skin tests. So they might try to do an allergy skin test, like on your back or something, and it's just not going to work as well because your immune system is being suppressed by the prednisone. All right, next category is metabolic. So a negative nitrogen balance due to protein catabolism, generalized protein depletion. Essentially, the prednisone is causing your protein to break down, and that leads to lots more nitrogen than usual. Now, endocrine disorders. So endocrine is hormonal things. All right, menstrual irregularities, dysmenorrhea, amenorrhea, and postmenopausal bleeding, which are all changes in a woman's period. Decrease or increase in the motility and number of spermatozoa, which means the sperm count is changing. Hypercorticism or Cushingoid state and appearance. It's a fancy way of saying the Cushing syndrome, the typical moon face and big belly. And they also call that Cushing's disease. Fat abnormalities, the redistribution of body fat, truncal obesity, buffalo hump, and moon face, where the fat moves to your face, your belly, and the back of your neck. All right. Along with that is the hypothalamic pituitary adrenal axis suppression. Say that 10 times fast. Which is less endogenous corticosteroids and androgens, which leads to adrenocortical atrophy. Essentially, prednisone turns off your normal cortisol system. Your adrenals turned off by prednisone. I don't know how to say that any simpler. Secondary adrenocortical insufficiency and pituitary unresponsiveness during stress, surgery, trauma, and illness. Your body just can't handle stress as well. All right, withdrawal, acute adrenal insufficiency, and death. This is why you can't stop taking it suddenly, or you can die. We taper for a reason. Withdrawal syndrome, which is anorexia, lethargy, nausea and vomiting, headache, fever, arthralgia, myalgia, exfoliative dermatitis, weight loss, and hypotension. All of those things are showing you how you feel awful when you decrease the dose too quickly. Next is growth suppression in children. So children who use prednisone and other steroids don't grow as tall or as much. Decreased carbohydrate tolerance or carbohydrate intolerance. Your body just can't handle sugar the way it used to. Glycosuria. So some of the sugar ends up in your urine. Appetite stimulation. You feel hungrier. Weight gain. Obviously, when you're feeling hungry. Okay, hyperglycemia. So the fasting glucose levels and postprandial hyperglycemia. That's high blood sugar from all that extra food. Latent diabetes mellitus. The diabetes appears. Increased need for insulin or oral hypoglycemic agents in diabetics. You need more diabetes medicines. Non-ketotic hyperosmolar state or diabetic ketoacidosis. You have a diabetes emergency. Hypocalcemia, decreased osteoblasts, malabsorption of calcium in nephron and gut, reduced sex hormone, increased dietary requirement. All of that means you have low calcium. That's why the doctors say you should take calcium with prednisone. Vitamin D depletion, increased dietary requirement. That means you have low vitamin D, so take vitamin D and calcium with your prednisone. Hypercortisolism, secondary to another disorder, more low cortisol. Hyperthyroidism or hypothyroidism. So you can have your thyroid gland go too high or too low. Either of them can happen with the prednisone. Now moving on to your eyes. Ophthalmic side effects. Posterior subcapsular cataracts. Like cataracts in the back of your eyes. Increased intraocular pressure or ocular hypertension, which is more pressure in your eyes. Glaucoma, more of that, an eye condition. Exophthalmos, your eyes are bulging. Lid swelling, I totally had that, but I didn't mention it. Your eyelid can get all swollen. Visual impairment, blurry vision and blindness. I forgot to mention that. I totally had blurry vision. I would wake up and I'd do I need a new prescription of glasses? Okay. Corneal perforation, central serous retinopathy, optic neuritis, ocular nerve damage. Fancy way of saying visual impairment. All right, last page, we're almost done. Neutropenia, febrile neutropenia. This means low white blood cells. Neutrophilia, high neutrophils, which are white blood cells. Leukocytosis, high white blood cells, right? It can go up and it can go down. Angioedema, swelling skin. Immunosuppression, weakened immune system. Urticaria, itching. Anaphylaxis, hypersensitivity reactions. Allergic dermatitis, and shock. You can be allergic to prednisone. How crazy is that? An infection can have the symptoms masked. So you can get sick easier and nobody even knows you're sick yet. Sepsis, which is a full body infection. And oropharyngeal candidiasis and mycosis, which is thrush on the back of your throat, like fungus growing. Ew. And finally, we will leave you with Kaposi's sarcoma, pulmonary tuberculosis, pneumocystis jirovecii, pneumonia. Now you try saying all that 10 times fast. Those are really fancy, terrible infections and complications of immunosuppression that usually only happen to people with HIV. But when you're on high-dose prednisone, your immune system is suppressed too. And so that is what can happen. If you need help coping with prednisone side effects, you should check out the rest of my prednisone videos. I have an entire series about prednisone side effects. And then if you click over, you can get your own way of coping and avoiding making the top 7 prednisone mistakes with my prednisone checklist. Check it out below.